So who of you is speaking English? Then I'm going to present in English. That makes it easier for you, right? Okay. Okay. I can tell you what you don't want to hear is my Dutch. Okay, we can start. I'm ready. Good afternoon. My name is Alexander from Biomed. This is my colleague Benjamin. And we are happy to talk about medical app development today. We are again on the Medica as every year. And you will find us around the corner. I show you in the end the slide where you can find it. It's around the corner there. And we will be happy to welcome you. We have fantastic coffee. And we do good apps. And how we do that, I would like to talk about a little bit. So, Biomed, a short block of a bunch of information about how we work and what the company is about. So we engineer medical software. This could be the end of the talk, if you believe it, but I would like to give you a proof that we really do it and that we know how to do it. And so we can say that we are one of the leading software development companies for regulated development of medical apps and medical software. Might it be a device software, a standalone software, but predominantly we do a lot of apps for drug delivery systems and other purposes. We are a certified company, of course, and we are not only following this norm and a lot of other norms, we are as well a manufacturer. So we just renewed our certificate, and so we can bring products into the market, which is probably of interest because you can see how far the processes go in our team and in our structure. We are about 100 people near Frankfurt Airport, and we don't do any offshore development or any freelancers or stuff. So we really, it's all dyed-in-the-wool people that are medical software people. So we would be happy to show you more about references, products that we did around the corner. But today we should go a little bit hands-on and show you what is a bit of our secret, because people that work with us and people do work with us for a longer time, so it's not just a one-hit wonder project thing. We usually work together with our partners and clients for a long time. And why is this the case? Because we have found a way to predict duration of a project and costs of a project very precisely. And I think this is what people like in our work, that we have the utmost transparency in the early phase. So you all have probably faced the situation that in the starting of a project, people wanted to know, well, how long and how expensive is a project? And why can we answer this? So this is a pie chart of our the people working with us. It's about 100 people, and the pie chart is in so far of interest because it shows a little bit how we work. So of course a lot of development people and software architecture and verification and validation people and requirements engineering people and usability engineering we do as well. So we believe that the right invest in the right phase of a software project is, well, the key for productivity. And this is what we do. We ask the right questions, and so we are really precise in predicting costs and duration. So what we do, for example, is we do a quick starter. And a quick starter is that we do make clear in about 20 days what are the requirements of a project. And you will see in the components that is about delivering assets to meet the norms on the one hand side and answer the right questions for the relevant factors. So we have a workshop, then we talk. I just wait until the announcement is gone. Where? So we start with a workshop and we ask what is the system you're going to meet. Is it an app? Is it going to be fully responsive? Is it iOS or is it Android? Is it connected to a hospital information system? Do we need any DICOM plugs or anything? So we make the technology clear in the beginning. And then when we have understood, and we would like to recommend this for you to do that as well in your projects, so then we do make description of the relevant personas, which is representative users for the usability process. The next thing is we make storyboards in a comic style, so to visualize the workflows. This is not only important to involve users in an early stage, it's even more important sometimes to convince internally the people having the money for the project. Sometimes the decision makers have no precise idea about this fancy app idea you're coming along with. And therefore it's easy to illustrate and to show the people how it works if you have these storyboards. And then we make a very precise backlog. This is done by Benjamin. And the backlog is very, very fine-grained. It shows all the functionalities of the planned software we know by now, and the implementation efforts related to a certain technology. So we should have made decisions about the technology here. Then we make a click dummy, which is in the amount of up to 10 interactive wireframes. So this gives you as well, according to the norm, the 62366, for example, the ability to have a early user involvement and give some users like healthcare professionals, nurses, doctors, or patients as well a click dummy to show them this is what we are planning. What do you think about it? To make it experienceable. And the next step is in this quick starter that we make a visual design suggestion for one central screen. So this might help you internally as well to show your boss or the people giving the money, the budget for the project, how this could look. And we make two suggestions in design. It's not just we come there with a bluish screen and say, this is the screen design that makes you happy for the rest of your life. No, we come with two screen design suggestions. One, for example, a green and a blue one, or a more conservative or more fresh one. And we say, this is how we understand your brand. Are we right? Which one would you rather choose? And then you can choose, and then we give some more screen designs on it. And then we make a regulatory clearance, because among our 108 employees, we have one full lawyer, and he's doing all the regulatory stuff. And we give some distinctive risk management input as well in this package for the regulatory clearance. And then we have a result workshop, and then we can go into the main project phase, and all the question that let other people panic are answered in this stage. So this is what people like in the work as we do it, and we would be happy to recommend you this workflow for your, well, I would say it's an extended feasibility phase a little bit. So if you're interested, you find us around the corner later on, and we can give you some more information about that. So the process is important. So it's not just that we have this quick starter package. Well, this is reality. This is project work. We have an underlying process, and I would like to show you how we function in our brains when we work. So first of all, I would like to ask Benjamin to talk about these norms. So we have them. All these norms are, when we sleep, we have it under our cushion, so we have quite a high pillow. Probably some of you have those as well under your pillow, right? Yeah. And well, this is a minimum set, isn't it? And Benjamin, I would like to ask you to give some words to that norms.
Yeah, thank you very much. And sorry for my voice. I have been in Cologne two days ago, so it's a little bit sticky. But first of all, of course, we are working in a quality management system accordingly to the 13485, and we are certified with that norm. So everything is detailed and described in our process we are working with. And of course, with the medical software development, you have to follow the 62304. So all the steps for the medical software development is defined in that norm. That norm then is combined with all the other norms like the ISO 14971, so the whole risk management. And for this risk management, we have a specialized tool. Maybe we can talk about that later on our part here. So we are the owner of the QA Risk Manager, and that risk manager will guide you through the whole process of the risk management for medical products. So you will guide it through the whole ISO 14971 and will do the risk management step by step. Especially, so since some months, we added to that risk management a second norm. So we added the 62366, the norm for the whole usability engineering file. And so you can do with our tool, you can do the whole technical documentation. There are more modules than only the risk management and the usability. We also have the requirements engineering part in it. We have the traceability part in it, so you can do the whole technical documentation with that tool, and it's all covered in that rule. That tool is also validated. So with the MDR, the validation of tools will be more important, and we did that validation already, so we can give you the validated tool, and we validate it with the GAM5 concept. And of course, other norms like the IEC 6061 for electronical systems and the 8001 are all combined, for example, in that tool or in the knowledge of our developers. So as Alexander said, they are sleeping with it under the pillow.
We will come back to those norms now, but we will see in the end of our little speech, we will see something about this norm as well. But the focus now is, I would like to emphasize it's important in the beginning of a project, these are the important ones. It's like usability, users, where do they work with the product, what are their intentions and their educations, what is the working environment, what are their goals, and what are the risks. I will come back to that. So if we look at the process structure, these are 3 slides for the process structure. Well, you can see here this is a typical representation of project steps, right? It's like a V model which we ironed a bit flat. And then we have usability, software development and verification activities, and down here you can see the norms when the onset is. So in the beginning, when we have a product vision and market research, this is what usually the clients have, and then they ring us up. Sometimes we are already there when this is in discussion, but usually our clients ring us up when they have the product vision, the market research done, and then the feasibility starts. And we would start in the usability level with use specification, focus group. We make site visits and we make wireframes. Some of the stuff you have seen in our quick starter package already before. And we do, of course, start alongside here with the activities in the software development, like a development plan, the backlog draft. I had mentioned it in the quick starter package already. And then we go on, so we have a system specification, development, design, transfer, verification, validation phase. You see here, this is UI design, formative and summative tests. You have here software architecture and design, the SOUP validation, which is a very common thing. So if we can integrate some control libraries, for example, it's our job to validate them, because we don't want you to save money for the price that then in the end it's not a medical product anymore because it wasn't has integrated a non-validated component. Then we make unit integration and tests and so on. The message is, if we have done the development and the CE marking, and if everything went right and we have the conformity, and this is when we go into the market, or you go into the market with your product. This is the point of time when we do not run away. we stay with you and we make an appointment for in 6 months, and then we say, let's do proper market surveillance, post-market surveillance together. And this is a very important thing at the moment, because the MDR has given the post-market surveillance a much more important role. And we see on a regular basis that post-market surveillance is actually not a burden, it's a chance. So if we go into the field and see what happens with a product, then we see on a regular basis if users do use a product, a device, a software out of the intended scope. They don't do it because they want to give us some problems. They do it because they miss a feature. And so if we want to continuously improve and make new versions of our product together, then we should have the post-market surveillance as a trigger for the continuous optimization of products. The notified body loves it anyway if we can report that we went into the field. And this is what we actually do. So we monitor it together on all these three levels that we describe. And well, of course, there is a definition of the post-market surveillance which I introduced, included into the speech. You can, if you want to have the slides, you will get it. What is more interesting is we have a list of what the MDR says, or what the sources say, what we can do for post-market surveillance. So it's customer feedback, including complaints, service reports, results and tests. Yeah, this is all the thing we actually look at. This is normal. And database of authorities, hotline input, science journals, result from post-market clinical follow-up studies, as well. Those are more important now according to the MDR, and exhibitions and conferences. But what almost nobody did in the past, and what we would like to recommend to do very much, is let's do site visits again. We do site visits when we make the requirement phase for a product development anyway. So why shouldn't we use this method of site visits as well for the post-market surveillance? It's so interesting what we see and what we find. I give you some examples what we see, of course. Simple thing is, I don't show you real data from our site visits because this is secret by our clients, but this is simulated information. Yeah, we want to know what is behind, what is the story behind this? The story behind this, what we find under the keyboards, we find those old odd post-its with 10 passwords on it. So obviously the software has a role concept and a login procedure, which is obviously not really suitable for the task because it wants you too often to log on. So if it's for safety or security reasons necessary to locate this application, then we should provide a more easy access for the user with a fingerprint or whatever, but we shouldn't force him 48 times a day to log on. Actually, this is clinically relevant because it costs money because of the workload. And this is users' work, right? So what we often find as well is an old post-it where we read on like password from Rita is Dennis. Dennis is the son of Rita. Rita doesn't work there anymore for 4 years now, but she was present when the software was installed. So if the post-it is lost, the clinic will not work anymore because then they can shut down, you know. So because what is the story behind? Yeah, it's so complicated to add a new user. So we should think about that workflow. Even though if the user interface designer did a good work and had a good intention in designing the workflows for the new user, the user management, probably it's not suitable for the task. What do we find when you go into the field? So we have a defibrillator. I'm a paramedic, and this is an accident in the countryside, and the defibrillator is on the bonnet here, and the cables go inside because inside the car there was the device used. Interesting use case, isn't it? Outside it could be dark, it could be raining, which is very likely when you have car crashes. It's not unlikely that it was raining and dark. And so the cables go inside. Did we have this in the risk management? Probably not. Or what we find as well, I took this from Dr. Scott's operating theater. This is a picture from 2010. And I said beforehand that we would come back to the 6061 norm bundle because we have electromagnetic compatibility here. And I like the picture of Dr. Scott so much because this is the anesthetist and he's getting some fresh information about the patients via his mobile phone. and you can see what's around him. There's, by the way, a patient and a surgeon, and then you have some EMC relevant stuff around him, which might influence actually one of the applications. And this is what we find in real world. So I sometimes say we perceive in product development teams a little bit like I call it a field phobia. So they don't want to go outside anymore if they just have launched their product and then they say, okay, now we sell it, I don't want to see what happens. And let's go and have a look at the reality again. I know we all want to have the fancy, perfect, clean, precise devices, and we should continue to develop them, but we have to face again and again the reality, and this will make us better together. And I don't have this field phobia. I love it going to those use contexts and see what really happens. So sometimes it's astonishing, sometimes it's a bit funny, sometimes it's a bit weird, but it's interesting all the time. Yeah, so thank you very much. And how can we support you? If you're interested in how we work around the corner, you will find that. And we would be happy to welcome you. Thank you very much.